Thanks, Mike. Well, good morning, everyone, and thank you for joining our town hall style information session that's reflective of the updated guidance for employers of international agricultural workers. I'm going to introduce our two speakers, Nicole Dupuy, who's the Chief Executive Officer at the Windsor-Essex County Health Unit, and Dr. Shankar Nesathere, the Acting Medical Officer of Health at the Windsor-Essex County Health Unit. So again, welcome everyone today. This session is being recorded. I'm just letting you know that for the sake of sharing that information. And I think Nicole will, or Dr. Nesathere will be leading into the first slide. And then there will be opportunities for questions. Dr. Nesathere, I'll hand it over to you.
So Nicole, perhaps you could forward the first slide. Colleagues in the agricultural enterprises, thank you for meeting with us today. Just to give you a sort of a snapshot of where we are in the pandemic, we're beginning the third year coming up of the pandemic, and I know that all of us have been disrupted, and all of our professional lives and business lives have been disrupted, and many of our institutions have been disrupted as well. Given that, the focus on today's meeting is about international agricultural workers. In Windsor-Essex, we've had 572 COVID-related deaths since the beginning of the pandemic. We have 43 active outbreaks. We have 525 high-risk cases, and that's probably an underestimate of the true burden of disease because we have diminished testing capacity. We have approximately 1,000 congregate living settings for migrant farm workers in the health district itself. So given that, we're in a continuing challenge during this pandemic, and we wanted to share today the latest guidance of the health district. So if I could pass that on to Nicole.
Okay. Good afternoon, everyone. So the purpose of today was just to, we did send out some documents last week that were just operational items, related to the change in guidance from the Ministry of Health related to agricultural workers. And so some of the key changes that we just wanted to highlight and provide an opportunity to clarify. So through a third party, there's a third party provider that must be a regulated health professional required to conduct twice daily health assessments of any worker and employer provided isolation. When a positive or symptomatic cases are identified, that has to be an in-person check. So if the person's asymptomatic or a contact, that in-person check can be done by phone or by text. So this is something that farmers will need to be considering and certainly make plans to have in place. And some of you may already have that in place. As well, so in order to respond to this, we provided a template. So there is now a WeChew provided template, and this is for submitting those health checks to the health unit. And they must be submitted no later than 1 p.m. every day. So when you have workers who are in isolation and they're subject to daily health checks, we would ask that third party complete the assessment form, and then they send it to us every day. As well, as part of this change, this third party provider would also be conducting the testing, so of high-risk contacts. So as many of you may know, those of you certainly who have experienced this within your agricultural setting, when you have a worker that's positive and the health unit has identified contacts that require additional testing, it's those additional folks that would be tested that would need to have their testing be done by a third-party provider and a regulated health professional. As well, some of the changes included also ensuring, and many of you likely already have this in place, but making sure that there's translation and interpreter services provided, again, by a third party, especially when you're talking about someone's health status. So, that's also part of the changes that are within the document. Additional changes would be the development of an isolation plan. And so again, most of you would probably already have this in place. So it's likely just tweaking it, but developing an isolation plan that must include an escalation process. So for example, if you have a third party doing health checks for individuals within a certain setting, and for those who become maybe more severely ill or require more attention, what will that escalation look like through your workplace, including making sure that you're addressing any after hours or the times when who are workers reaching out to out of the times where your operation is normally working. Employers must have up-to-date COVID-19 isolation plans available to us. So again, having your isolation plan, but also ensuring that that is available to the WeCHU, whether it's through our case and contact management team or your public health inspector when we've asked for it. Cases and high-risk contacts not to be released from isolation without our clearance. So again, we know we do have a funded IRC here, an isolation recovery center, but also there may be workers isolating elsewhere within the community. And so it is the Windsor-Essex County Health Unit that actually clears people from their isolation. So just making sure that that is clear, and we've provided some direction on that as well. And ensuring, again, that cases in high-risk contacts, so individuals who are positive and their high-risk contacts that have been identified by the Windsor-Essex Health Unit, do not return to an employer-provided accommodation like a congregate setting. So if we've directed that individuals are isolated outside of their current accommodation, they wouldn't be able to return to that accommodation for the full 10 days from the time of their exposure or the date of their positive test. And I know we've received some questions already, so we'll go into those questions and answer, as best we can to ensure that we've clarified everything. So right now, if you want to submit questions, you can do so by using the CEO@wechu.org email, and that's for the purposes of this webinar. And then beyond this webinar and going forward, we have the covidfarms@wechu.org email that you can, on an ongoing basis, certainly submit questions, and someone from our team will respond. I also just want to highlight before we get to questions that we have a number of our team members that are part of our response, whether it's outbreak or case in contact, on today's session. And so while Dr. Nasseri and I may tackle many of your questions, we may certainly throw it to a team member who are the real expert, to be honest. And I'll just acknowledge we have a couple of our directors. So Felicia, who I see her, she just popped on video. So Felicia Lawal is our Chief Nursing Officer, and she is the director of our case and contact management and our COVID response. And then Christy Macbeth, I just see her video popped on as well. And she is a director with oversight of our outbreak management, our outbreak team, and our environmental health, which includes all of our public health inspectors. So they're the real experts, but I just wanted to introduce you to them as well. And again, we'll get started on questions. So I'll maybe throw it back.
All right, thanks, Nicole. The first question that we have here is the brief states that there is a 5-day self-isolation followed by 5-day post-isolation of strict masking and physical distancing. Does this mean that a worker can return to their employer-provided housing on day 6 if cleared by the health unit?
Well, a couple of things to think of. First of all, we're all in this together. On day 6, on day 7, on day 8, on day 9, people are still infectious. They can transmit COVID to other people. So it is true that on day 6, there'll be some people that will be eligible to return to work. They cannot return to environments where they're likely to transmit COVID to other people. So those environments are places where people share bathrooms and kitchens. Every outbreak is managed individually, and in managing an outbreak, we look at the potential environments on day 6 and onwards. But those environments cannot include environments where people share bathrooms and kitchens. Whenever we manage an outbreak, the outbreak is also informed by the circumstances of the individual outbreak, and also the experience that an operator or that enterprise might have in managing previous outbreaks as well. So we'll make a decision based on that. But as it goes to sharing kitchens and sharing bathrooms, those are not appropriate places for people in day 6, 7, 8, 9.
Thank you. Another question here. If we cannot provide for self-isolation with a dedicated bathroom, will the health unit approve shared accommodation? In what circumstances would this be allowed? And how does the employer handle this conflicting with IRPA regulations that require for separate accommodation?
So Windsor-Essex has suffered disproportionately from COVID-19. And it's just the number of people who get sick and go to the hospital, and the number of people who die from COVID is directly related to the number of people who've been infected with COVID in the community. On day 6, 7, 8, and 9, in appropriate circumstances, people will still be required to be housed in living circumstances where there's a separate bathroom and kitchen, and that is the guidance of that is the direction of the Public Health Service. The statute contemplated public health direction. We operate under the Health Protection and Promotion Act, and the legislature contemplated the fact that public health measures have to address the local realities of different health districts. And Windsor-Essex has certain factors that make it unique compared to other health districts in the province. And so our guidance is articulated, the Public Health Service guidance is articulated in the documents. And the goal is ultimately to reduce the transmission of COVID-19 with these guidance documents. Nicole, I don't know if you want to supplement that.
Yeah, I would just add, so I think the question is if you cannot find isolation. So I did note in some of the not really a change, but that all workplaces who have these types of accommodations, like employer provided accommodations for workers, need to have an isolation plan. So you need to have no different than you would do for, say, I think for quarantine purposes, is there needs to be a plan and consideration for how you will isolate individuals if you do have an exposure. And you'll need to think through, and certainly we're here to support. So if you need to reach out to talk through it, but you'll need to think through, how many workers you have, how many, what that would look like from exposure, and how quickly could you get them to isolation. So that may be, maybe you have the ability to do that within, on your farm, but you may, it may be contracting with hotels or, so it's thinking ahead so that you can act at that time. We also, obviously, we do still have we're lucky enough in our community because of the large number of individuals, temporary foreign workers who are living in shared accommodation within our region. We're lucky to have the IRC, so the Isolation Recovery Center. It does have some criteria for referral, so our team, will certainly refer based on that criteria. So that's anyone, unvaccinated or symptomatic or positive, we'll be able to refer there. But you still have to have a plan to have that isolation in place. And as Dr. Nusaturi said, we would be looking to follow the guidance on what is the best isolation, which is having their own bedroom and bathroom.
So if I could supplement that as well, this is an opportunity, and I think it's an opportunity for all enterprises to review their isolation plans and what their plan would be if there were a small number or a large number of people affected in the residence of members of the migrant farm worker community. I think it's also worth sharing, as of today, there are the hospital capacity at Erie Shores is 125% of census. So the hospital is already saturated today as far as capacity goes. And one of our goals, public health goals, is to maintain access to the hospital for members of the community, including members of the migrant farm worker community, people who do not live on the farm but work on the farm, and also the broader community of individuals. So that weighs into the decision making as we move forward.
Okay, another question here. Can you please confirm that unless a worker is isolating in a Red Cross facility or an isolation and recovery center, the employer will need to facilitate third-party assessors to check in twice daily with our workers, once in person, administering a rapid test, and once by phone, and must submit their assessment to the health unit daily by 1 p.m.
So maybe I could start with answering this in, conceptually. Checking in on people who are in self-isolation is an important goal, because we know that people have succumbed to COVID during the self-isolation period. And so I think it's important that the individuals are monitored. The requirement for a third party, I think, will provide an additional layer of safety or to support people who are currently in self-isolation. I think enterprises will have to formulate a plan to achieve this goal. But I do think it's a positive step towards advancing safety. Nicole, perhaps you can supplement that.
Well, I think you're just, trying to confirm. So the third party provider is articulated both in the guidance document from the province as a requirement as well. We just, our document was just to capture how we want that third party to report to us, because they are, assessing health status, and that's a requirement under our current Section 22 order that, health status be assessed and also certainly reported to us. So I think maybe to answer your question, it is, we're confirming, yes, that is a requirement. It's a requirement in the provincial guidance and reflected in our own guidance, as well as it is in our Section 22 order around checks. And I would just defer you back to our guidance and the provincial guidance around the frequency, but the submission of those health assessments in the form that we put in our guidance would be, we would ask that that be submitted to us, yes, daily by 1 p.m.
Thanks, Nicole. You mentioned the Section 22, so the next question I have here is, what are the conditions for lifting the Section 22 order?
Well, the Section 22 order ensures that individuals are guaranteed or culturally appropriate food, water, medical assessments, monitoring, and I think those are requirements that are essential to keep people safe. We continue to monitor where we are in the pandemic. And at the current time, our plan is there's no plan to withdraw the Section 22 order. We'll continue to monitor and then make judgments as we have more information as the pandemic progresses.
Thank you. Please give advice about reporting to the health unit if a worker tests positive, which must be completed by a third party. And there are a number of questions here around what would constitute a third party, or if you could provide an example of a third party agency that would provide that service.
So, Nicole, perhaps you could comment on what the substantive part of that question.
So if for the reporting, sorry, if you could repeat it, Eric, it was a long question.
Yeah, no problem. So please give advice about reporting to the health unit if a worker tests positive, which must be completed by a third party. And then there's supplementary questions, which we've received from a few participants around what do we mean by a third party?
So I'll start, and certainly, we can always have Felicia join as well. But so if a worker tests positive, there's not a lot of change right now, and then the document doesn't capture any change for how those things are identified now. So for 2 years, workers have gone, to assessment center, have been tested on farm, and we're notified of that. Obviously, we're notified if it's a PCR test, we're notified through the lab system. If it's a rapid test, we're not. But either way, we ask the farms to notify us immediately because we want to start that process certainly right away from a case and contact management perspective. And then, as we've directed additional testing. So once you have a case and then we have contacts that we have directed testing, I think that's probably a little bit where the change will be, where now it'll be the third party that will be reporting that information to us. So maybe I'll just quickly ask Felicia to comment on it. And then as far as examples of the third party, they are, it is described in our document. So I, again, refer you back to the memo. We did provide some definitions and description of what we mean by a third party and a regulated health professional, but we can provide some comments on that. Go ahead, Felicia.
Yes, in regards to when the third party becomes involved, as Nicole mentioned, the third party comes into play the moment we, as a health unit, become aware and have initiated case and contact management, and we'll give you that direction at that time. And so, as Nicole mentioned, right now, the first case usually comes to us either through the provincial system, where you've gone to the lab or the assessment center to get tested, or if you've done that initial testing on the farm, and that can be done by anybody. It doesn't matter at this point, but it really does come into play with the third party when we become aware and we've started working with you as an operator and the cases and the high-risk contact and provide directions to say this is what must come into play. Now, in regards to who a third party or regulated health professional is, yes, there is a number of regulated health professionals, but in the context of COVID and what we're trying to do and assessment and testing that needs to happen, an example of a third party will be a nurse, for example, a regulated one, because again, a regulated health professional, they know their scope, they know their requirement, and they have accountabilities. And that's what we really wanted to try to get here, to make sure that the cases or the high-risk contact are getting the appropriate assessment, they're getting the appropriate test, and supported throughout that period. Because again, going back to Dr. Necessary comment, people need to be assessed and supported when they've been exposed to COVID and not left to their own devices. So, but if you want to refer to our document again, it talks about the regulated health professional, and keeping in mind the types of information that we're requiring. When you look at our template, we're asking for assessment of symptoms. So a regulated health professional that can assess, for example, a nurse or a physician that can assess to say, yes, this person doesn't have a fever, but they have to be regulated. A regulated health professional that is practiced and has the scope and ability to be able to take a test or perform a test, for example. So those are things that you need to keep in mind. While the list might be long for who a regulated health professional is, for this context, that's what we're referring to.
If I could share, if the goal is to keep people safe and monitored appropriately, then the skill set of the person doing the assessment has to be concordant with the task assigned to them. And as a general construct, someone who's a regulated health professional will have the capacity and the professional training to actually execute on the monitoring plan.
Thank you. Nicole, did you have something you wanted to add?
No, I think it's been covered. Thanks, Felicia.
Can you please confirm a third-party provider is only used when there is a positive and/or symptomatic case, not for workers coming into Canada who have just been tested for COVID at the airport?
So Felicia's hanging on. So that's a complicated question because it's dependent on whether they're in isolation or in quarantine. And so there are this guidance didn't apply to quarantine, it applies to isolation. However, once there's a positive case, so I guess the answer is, once there's a positive case and they're under the direction of the WECHU for isolation, that's when this would come into play. And Felicia can add to that, but and we know there are individuals who are newly arrived who are under direction for isolation, whether they're a contact or they're a case. So that's really what I think the factor is whether they're whether they're under the direction for isolation.
Yes, that's Nicole, you're correct. And I would just add again, think about when WECHU becomes involved. So when we're talking about quarantine, there are people in quarantine that we may not be aware of, and that's because they are not neither a case, nor they're high risk contact, and probably they got tested at the airport and they're in quarantine awaiting their result. The moment they become a case, then WICHU is managing them. That's where these requirements and our directions come into play.
Thank you, Felicia. If someone has a roommate, will they be able to leave isolation at 5 days and then follow the masking procedure for the next 5 days?
Do you want me to?
Sorry. No,
Oh,
I'll just
okay.
go ahead, Shanker.
It's okay, Felicia, why don't you start and I'll supplement it, because I think the context of the question is a little confusing to me.
Yes, so if someone is in isolation, they will not be with a roommate. So they will be in self-isolation, which means that they're alone and isolating alone and have access to what they need to be isolating alone. So I don't know that will be a scenario that we should be encountering if we're abiding by the guidance document that we've put out and the directions.
Dr. Nissathuri, did you want to add to that?
Yeah, fundamentally, self-isolation means one is isolated alone and and uses their own bathroom and kitchen. So I don't think there would be a circumstance in the Windsor-Essex Health District where people would be self-isolating if a person's infected, they'd be self-isolating with somebody else. So I think Felicia's answer is sufficient. We can always comment on individual cases, facts, and circumstances.
Yeah, and if the individual who submitted that question wants to provide additional context, we can try and circle back to that answer.
Sure.
Says it states regulated health professional. I think we've actually covered this, but I would assume this would be defined as RPN or higher. But technically a chiropractor or a massage therapist are regulated health professionals. And I think we've commented on that in terms of the scope of responsibility. For interpretation services, is there an application we can file to apply to use our in-house staff for Spanish?
So maybe I'll start on that. There isn't an application process. Our recommendation and guidance within the document around interpretation translation services to be a third-party services because you're talking about healthcare. And so this is about translating and interpreting for individuals their healthcare. And so there should be one that requires a certain type of specialty and training as well to make sure that the information is interpreted correctly, but also we want to maintain the workers and individuals' privacy. They're talking about their health and well-being, and just as anybody would want to be afforded that privacy when they're talking about their health. So it's around the interpretation. It could be the third party themselves have individuals who potentially speak Spanish, and there are designated positions and many, depending on who that third party is. But if not, making sure that you have interpretation services and that those interpretation services are outside of the organization, because this is about translating someone's healthcare. And I don't know if Dr. Nissathuri would like to add to that, or Felicia for that matter, but the direction is that it would be outside.
Yeah, as a general construct in medicine, we want to protect the privacy of the people we serve. We many times ask people questions which are sensitive, or they may not want to volunteer. And so the most appropriate course is to have someone who can process the health or receive the health, ask the questions, but also receive the information in a non-judgmental manner. And that's the general view in medicine, and I think that's the proper view.
I will just add that, and again, this can go to the farm email, but certainly there are different services for interpretation, and we could, if need be, if there are questions about where to go or how best to obtain those, we can provide some of that information, at least locally, who provides those types of services.
Thanks, Nicole. I did see one participant with their hand up. If you could submit your question to ceo@wechu.org, that would be the best way to get your question submitted. Question here, once it is established that a third-party provider is required, does the farm have to hire a regulated nurse on their own, or will the health unit provide someone or refer someone to the farm?
Maybe I'll start. So again, we can't provide necessarily direction on how you operationalize or prepare, but I would ensure that you have a third party in place, or at least some plan for who that third party will be in the case that you do have an exposure, a case within your setting. And again, that's part of that plan that may need to be revised for all agriculture settings that have these types of accommodations. So we certainly wouldn't want, to be in a scenario where you're trying to figure out who your third party will be at the time where you're also needing to isolate and monitor people. So that's just, I just want to make sure that that's really clear that you'd want to be doing that in advance. And I'm sorry, Eric, I might have missed the other part of that question.
Yeah, it's about the third-party provider and whether or not the health unit provides that service.
Yeah, so we would not, and I think the question was whether or not they would hire their own nurse.
Does the farm have to hire a regulated nurse on their own, or will the health unit provide someone or refer someone to the farm?
So we will not be providing that. It would be up to the organization to put a plan in place, and I believe, again, I'd refer you back to the ministry document, as well as our own, where it does reference some, operations may have, for example, on staff already, occupational health nurses, and, that identified as one potential, consideration, but, otherwise it would be up to the organization to identify who that third party is, and then identify who that third party will be to the health unit at the time that we request.
Yeah, if I could just supplement that, I think the questioner quite rightly highlights an important issue, which is that this is the time to formulate, refine, and review the isolation plan, so that if there is a contingency where a regulated health professional is required, that person is readily available, and having that person readily available will also effectuate a more prompt resolution of an outbreak.
If the daily reporting should be done by 1 p.m. when workers are in quarantine, does this mean that 2 daily checks should be completed by 1 p.m.?
I think that's the in-person health check. So the 1 p.m. was the submission of the in-person, the spreadsheet that we would want that submitted daily by 1 p.m. And Felicia is jumping on. She can clarify as well.
Yes, we would like, especially the in-person assessment, what we're looking at is to be able to, if we need to escalate or support individuals that may have been identified that are symptomatic, because that has to be done in person. And so we will require that be submitted to us by 1 p.m. for that reason. But if it's a phone check, you can do the phone call a second time later in the day. But by 1 p.m. you would have done your initial checks for sure. Or we would expect you to have done your initial check before 1 p.m. because it allows us, our team, to be able to review that information that we sent, especially really looking at those ones that are symptomatic, and see how we can support or make sure we're connected with the individual, and to make sure they have the services and support, and if anything needs to be escalated beyond your third party.
Thank you, Felicia. This is a clarification on the earlier question that was provided. So it says the guidance states 5-day self-isolation for fully vaccinated workers if improving symptoms and no fever. If they are completed for their 5-day self-isolation and are allowed to leave isolation under strict masking and physical distancing, are they able to enter their shared accommodation? And if yes, are they able to return to their shared accommodation on day 6?
So maybe I'll just start. Again, I defer back to both the memo and the document that we circulated last week. It does clearly state that we would not, that they would not return to their shared accommodation until the post 10 days post whether they're a positive case or from the exposure. So in the circumstance where individuals are able to say return to work, so they're no longer, they're able under strict masking and physical distancing, they could go back to work potentially on day 6, but they would not be able to return to a shared accommodation because you cannot maintain those public health measures that are necessary. So they would have to remain in their single isolation until that 10-day has passed. And I don't know if Dr. Nasseri would like to add to that, but it is clearly articulated and outlined in the document.
So just to supplement, I think the document is explicit in its direction, but there's also a practical matter to this, which is the first is it's well settled that one can infect other people on day 6, day 7, day 8, day 9. That's well settled. Secondly, when one returns to a setting, one has a bunkhouse with bunk beds and shared kitchens and shared bathrooms. It's likely that people are going to transmit COVID to other people. And so the guidance is, and the direction is on day 6, day 7, day 8, day 9, those individuals remain in a residence where they can't transmit COVID to other people. And so that is our guidance. What we don't want is endless outbreaks on farms or other enterprises and other congregate settings. And that is the reason we've formulated this direction to try as best as we can to try to bring these outbreaks to conclusion. The second item is that farm operators and members of the migrant farm worker community and other workers, we're in this battle together. And the number of people infected is one key determinant of the number of people who ultimately go to the hospital and the number of people who get admitted to the ICU and the number of people who die. And the goal in the public health service is not only to help the individual who may or may not be infected, but it's also to help their immediate community and help the broader community and to help the overall county and the health district. And these measures and the public health measures up to this point have worked within this framework. And we continue to ask for people's understanding as we move through the pandemic.
Thank you, Dr. Nasseri. I think that brings us to the end of our question period. So I want to thank everybody for their participation and advise again, if you do have additional questions, covidfarms@wechu.org is the best place to submit those questions. So I want to thank everybody again and wish you, oh, go ahead, Nicole.
Oh, it looks like someone put their hand up, so I don't know if they have a question that they want to submit quickly. But otherwise, yeah, going to the farm.
Yeah,
email.
CEO@wechu.org. We can give a couple minutes, or we can give a minute or so here.
All right,
Okay. I think that can bring us to the end of our session today. So thank you everybody for attending and have a great afternoon.
all the best.